Today, there are a few cases of cancer patients that share with me their story. Most of the cancer, I can't give you the testimonial like the X-ray before and after. I think is a bit too confidential already. But this is something that I've kept for quite some times, and just want to share with you the power of the patches in terms of tumor. Okay, so this lady was in northern part of Malaysia. She was diagnosed with breast cancer, and after the breast removal, there was a lot of pus. Okay, there was still a lot of pus, and she had to go for the wound cleaning very often, few times a week. And but sadly, seems that the tumor has spread, and you can see this a lump just beside the neck. So it's quite devastating because after you remove the breast with all that you have suffered, and yet it still spread, and yet you still have another area of worry, right? So after putting the patch, less than 2 months times, less than 2 months times, okay, I always say average of 3 months times, just to let you know, everyone has a different reaction to the patch. No, no, everyone react the patch the same way, but your body has different progress for different kind of problems. So less than average about 3 months time, the tumor just disappeared just like this. Okay, so even the doctors was very surprised. And I remember when I showed this photo, a lot of people ask why LifeWave patches by putting a stickers is able to make the tumor disappear. And the answer is this. The difference between a tumor and or we say the cancer and a healthy tissue is the healthy tissue contains cell that has a self-destruction mechanism. That means the cell we understand, oh, now it's about maybe for our intestine, our digestive tract is about 1 week time. So after 7 days, the cell will say, okay, it's time for me to say bye-bye so that a new cell can replace me. And maybe for bone, for liver, it will take few months time. Okay. But for a cancerous cell, they do not know how to commit suicide. They will continue to divide uncontrollably. This is why they become a lump. So X39 elevate GHK copper, and GHK copper is able to reactivate the self-destruction mechanism in the cell. So this is why the cancer cell will start to die off by itself. Okay, so there are three groups of cancer patient normally. The first group of cancer patient is they are diagnosed with cancer. They are reluctant to go for chemotherapy after hearing all kind of story from their friends, and they are looking for natural solution. Okay, and I can't say LifeWave is the best compared to everyone else. Then it will be a salesman technique already. Everyone say their product is the best, right? But I can guarantee you this is definitely the safest. Okay, compared to all kind of detox, now I even see a lot of people are telling me, can I go for Thailand, go to Penang, go to what do you call the Chiang Mai to have a 5 days detox and drinking the olive oil. Okay, so I say when you go to all this, like getting rid of your stones, right? It is olive oil and apple juice. And then when they come in, they say, yeah, it's true. Really apple juice and olive oil. Yeah, they are making money. They are trying to make money from you by sending you to a places that is actually very cheap, and then let you do something that you can do at home. It's not a big deal. But you getting off all this stone, it doesn't fix the root cause of the problem, which is the organ function. Okay. So this is why when you meet people are looking for natural solution, they have tried everything. LifeWave is the safest to try. Okay, so 1 week or 2 weeks later, even they really need to continue with the chemotherapy or radiotherapy treatments, right? It's okay. This is what the brain partners always feedback. You say, my doctor say I'm the healthiest looking cancer patient. Always. So if someone not yet experience not yet undergo the chemotherapy, right, is the best time for us to talk about LifeWave. We can recommend to them, let them pet, it's okay, why don't we try, at least give your body enough stem cell, reduce the inflammation, you have more glutathione. X39 also elevate glutathione, right? With all these antioxidants and stem cell in your body, later on when you go for chemotherapy treatments, right, it can bring down the harm to your healthy cell to the lowest level. This is at least what we can do. So when they try the patch for maybe 2 weeks later, right, most of the time they will say, oh, I feel so much better. Normally people are at terminal stage, right? Their body is so weak. So the improvement come from the patch, right? Always quite fast one. Okay, they will see big changes. So people who are undergoing chemotherapy or dialysis, these are the two few group of people you will see a very, very immediate change of their skin complexion. Okay, when they go for chemotherapy, radiotherapy, they will have faith, they will continue to patch during the chemotherapy. Normally, this is how they will say, wow, when I go for the chemotherapy, I was going around to talk to a lot of other people that is this using the chemotherapy, and they are looking at me. Are you a visitor or the cancer patient? You don't look like a cancer patient, you know. Almost guaranteed they will have all these kind of comments. Okay, this is the first group of people. They have some buffer before a chemotherapy treatments. The second, the second is for those who already undergo chemotherapy treatments already. So for those who already undergo chemotherapy treatments already, normally we can introduce, but we don't recommend. Okay, we can say that why don't you give it a try? Okay. So we can't say like this. Why don't you take a look about this technology and see whether you want to try it out on yourself. Anyway, nothing entered the body. There's no drug, there's no injection. So this is always something you can approach. And for those initially, normally I suggest only Aeon patch for the people that they are undergoing chemotherapy. But I think almost for the past few months times, right, I see a lot of customers, right, they are so faithful about the products, right? They want their loved one, their kins to use X39 in daytime, Aeon nighttime, even during chemotherapy. And their feedback is they are no much of healing reaction. They feel good about themselves and now they have the hope. Initially, they feel like they're giving up already. But now because of the patch, they give them back the energy. They feel that they can fight. They can overcome this cancer. Okay. The third group of people, maybe it's a bit too much. We focus on these two first. The first one haven't experienced the chemo. The second one already undergo the chemo. The first group of people we can recommend. Hopefully they can use as soon as possible by the time. The second group of people is we introduce to them, let them think about this. We analyze the pro and cons of our patches. But my assurance to use is this. These customers will see good result. Okay, just remember you must take photo in terms of their photo, the facial complexion will get so much better. Okay?